Acha. Now basically we have the accessory nerve, which is the 11th nerve, and it is a motor nerve, but it has sensory and motor both components. Now accessory nerve is is having two roots, the cranial root and the spinal root. So basically from the nucleus ambiguous, the cranial root arises and the interior surface of the medulla and passes between the olivary nucleus and the IOP, and then it enters the jugular foramen. And then it comes out of the jugular foramen. Then what about the spinal root? The spinal root is going to come upwards into the skull from the spinal cord. So it comes from the C1, C2, C3, C4, C5 and of the spine, and goes posterior to the denticulate ligament, anterior to the dorsal root, and then ascends via the foramen magnum into the jugular foramen. So this is an MCQ point, that which part of which nerve passes to the foramen magnum? The spinal root of the accessory nerve. Okay, spine से निकल के ऊपर जाती है, फिर इससे जाके कंबाइन होती है, फिर दोनों जुगुलर फोरामेन से गुजरती हैं कंबाइन होकर एक स्ट्रक्चर बन के, फिर जुगुलर फोरामेन से जब बाहर आती है ना, फिर दोबारा अपने दोनों पोर्शंस में दोबारा रीडिवाइड हो जाती है. Okay. Now the cranial root, which was from the nucleus ambiguous, it basically joins the vagus nerve inferior to its inferior ganglion, and it supplies a pharyngeal. It is going through via the pharyngeal branch and the recurrent laryngeal branches, and it supplies the pharynx, larynx, and palate. Done. Whereas the spinal root, which went up via the foramen magnum and then came back via the jugular foramen and then redivided. This is going to run downwards and laterally and enter the deep surface of the sternocleidomastoid, which means that it is going to supply it. Now this is a rule. Every nerve supplies the muscle that it is going to pierce or pass through, except for one. There are some exceptions to the rule, we'll discuss it later, but in this case it enters the deep surface of the sternocleidomastoid, which means it supplies it, and then it crosses the posterior triangle of the neck, and then it supplies the trapezius, and then it also connects with C2 and C3 ansa manbrach. I am not sure, but this is known as ansa manbrach. Iska koi reference nahi mujhe mila. Now, so this is the whole accessory nerve pathway. Now, the MCQ point is that if someone has vocal cord, trapezium, and sternocleidomastoid paralysis, which nerves are going to be effective and which foramen lesion is going to be there? Now, remember, sternocleidomastoid and trapezius are supplied exclusively by the the spinal root, sorry, not the sensory, spinal root of the accessory nerve, and vocal cords are going to be supplied by the vagus nerve and the cranial root. So this means that lesion of 10th and 11th, both nerve is going to be present. So these are passing through the jugular foramen, so which means that this is the lesion of the jugular foramen. So jugular foramen has interior, middle, and posterior portion, and by the middle portion we have the passage of the 9th, 10th, and 11th nerve. And looking at this statement of the MCQ, these three are going to be paralyzed. So in this case, 10th and 11th nerves are going to be affected. So the jugular foramen is the answer to this MCQ. Now, okay, this is it.